Aloha, happy Wednesday. Thank you so much for joining us here on Spotlight Hawaii. I'm Yanji Denise, joined by Ryan Kalei-Suji. We, of course, try to bring you experts throughout the islands to talk about the issues facing our community right now. Of course, a big issue and top of mind is the vaccine rollout for COVID-19. Just check the Department of Health's website, Ryan, and over 200,000 vaccinations have been administered throughout the state since they started doing that in December. That 200,000, of course, doesn't translate to people. That's a mix of people receiving their first and second doses. So today, we have a medical expert joining us to talk all about the rollout, the vaccine, and to answer your questions.
Yeah, we've heard from many officials, state officials that we've spoken to on this program that have continually said that Hawaii can handle the influx of those who want to get the vaccine. The biggest problem is just the availability of that. Joining us this morning is Dr. Melinda Ashton from Hawaii Pacific Health. Good morning, doctor. Thanks so much for joining us.
Good morning. Thank you for having me.
Let's start off with just getting an update on where we're at with the vaccine. We're hearing we heard from the governor earlier this week about how the state can do twice as much vaccines and getting shots in arms than what we're seeing right now. What are you seeing with the vaccine plan that you folks have in place at Pier 2 and what's going on your end?
Right. I think we are all seeing the same thing. The supply is sent to the state, and so it's distributed around the state. So we certainly could do more than twice as many of the vaccinations that we're doing right now. Currently today, we're doing probably just over 1,500 shots. Those will almost all be second doses. And we'll be continuing that. We started our mass vaccination clinic at Pier 2 21 days ago on Monday this week. So 3 weeks of second doses, and then we're hoping that the vaccine supply will increase so that we can start giving some first doses as well.
And if you could, walk us through what that process is like. Once you've been able to successfully register in a secured appointment, when you show up to Pier 2, what is that experience like?
Right. So actually, over and over again, what we hear from the people that come through is, wow, this was so efficient. It was so pleasant. Everybody was so friendly. So first of all, we'll give you information about paperwork that you can fill in before you come in when you have an appointment, and also where to park. So if you're mobile and can walk 5 minutes, you can park at Restaurant Row, and we'll validate that parking. We also have parking at Aloha Tower. But for people who have mobility issues, which of course a number of the folks in the 75 plus age range do, there's actually parking right there on site at Pier 2. So our parking attendants will help to make sure you park in the right place, get out of your car, you come into the entrance and go straight to the departure lounge at Pier 2. So anybody who's been there, that's where you would get on a cruise ship. And you register there. Almost always we have no lines. We have 20 plus registration kiosks, and so people generally walk straight up and register. So that would be a confirmation of your appointment, making sure that your ID is who you say you are, and then checking on your insurance status. If you don't have insurance, not a problem, but if you do, we get that information from you. Once you've registered, you go straight through into what is also usually a very short line or no line at all, and you go straight to one of 4 areas where we provide the actual vaccinations. We call them pods, but it gets a little confusing because every vaccination site is also called a pod. But we actually modeled our pods after how we had set it up at Kapi'olani Medical Center when we were first learning how to do our employees, and so we mimicked that that kind of process. So we've got 5 vaccinators, and so you would be called over, you would sit next to the nurse or a medical assistant or a pharmacist who's going to give you the shot. They'll check your paperwork, talk to you about allergies, give you the shot, and then you get a sticker on your arm telling us what time you're done with your observation. People will generally wait 15 minutes to be observed, just in case there are any side effects or adverse reactions. Some people with a strong history of allergies would wait 30 minutes. And so that time is on your sleeve. And then during that waiting time, we have nurses and others who are checking in with you to make sure that you're doing well. If this is your first dose appointment, you will also at that time confirm a second dose appointment, so we know when you're going to come back and get your second dose. As I said, right now, most of our folks are getting their second doses, so they don't need to make any more appointments. They're done after that. And they get a handout sheet with things to watch for. And then at the time that they're done, they exit Currently, Medigold is providing POG juice to folks every day, so they get a carton of juice on their way out if they'd like it, and their parking validation if they didn't park at Pier 2, and they're done.
We want to bring in a question from the audience. Heidi this morning is asking if you can speak about Moderna and Pfizer's effectiveness with the newer variants. We're hearing from the Department of Health of those new variants that are being found here in our islands. What are you learning from what you're seeing with the effectiveness of the vaccines in combating some of these new variants?
Right. It's a little bit of an unknown. The Pfizer and Moderna vaccines were actually tested and approved before these variants were recognized. And so the Johnson & Johnson and the AstraZeneca vaccines were actually tested more directly in South Africa against the most worrisome variant. And it shows a slight decrease in the effectiveness of the the AstraZeneca vaccine. For Moderna and Pfizer, everything that I've seen so far says that they are likely still effective. There are different variants. So the UK variant probably still quite effective. The South Africa variant, still a bit of a question, but worth getting vaccinated because the science is not clear. We don't know until we've had vaccinated people in areas where they're exposed to large quantities of this virus circulating in the community.
And once you do get that second shot, can you tell us a little bit about what your recommendations are in terms of adjusting behavior? Do you still have to wear a mask? Can you still catch COVID? What are you seeing in terms of that?
Right. So the recommendation is not to change any of that behavior. So still wear a mask. Yes, absolutely. Still try to keep that physical distance that we're all aware of. Try not to gather in groups. And the reason for that is it's still an unanswered question whether someone who's fully vaccinated and less likely to get severe disease, whether that person does still have a chance of having the virus in their nose and still able to spread it. That is an unanswered question that is being worked on right now. The initial data, it looks promising that in fact someone who's fully vaccinated and has an immune response should not be able to carry the virus in their nose as effectively or for as long, or maybe not shed it as well, but we just don't know that yet. So the mask is still necessary.
Have we seen any cases of those who have gotten the vaccine but still have contracted and tested positive for COVID-19 despite getting the vaccination shot?
Yes, it's known both on the mainland, and I understand from Dr. Campbell here in Hawaii that there have been a few people who have tested positive for COVID, but they have been after their first dose of vaccine and usually within the week of the first dose. And so it's thought that they probably contracted the virus right around the same time as the vaccine. We know it takes days for your body to react to this vaccine. So that first week or 12 days, you really don't have very much protection at all. So that wouldn't be surprising that the rate of contagion would still be about the same as non-vaccinated.
And I know you mentioned that after you get that first or whatever shot you get, that you do have to wait for 15 to 30 minutes just to test for an allergy response. What are you hearing in terms of any kind of side effects or ill effects? We have heard anecdotally that the second dose can yield a bigger immune response, and so people tend not to feel as well. But are you hearing of any severe side effects here in Hawaii?
I believe there have been a couple of people who have had some relatively serious reactions to the vaccine. We have not experienced that among the patients and our employees at Hawaii Pacific Health. What we commonly see is no reaction at all in that first 15 minutes. That's the most common. But if someone feels ill, it's often because they're anxious, or they tend to faint when they get shots anyway, and so they faint with this shot too. So we've had a few people like that. As a pediatrician, we know that there are kids in our practice that faint, and we lie them down when we give them a shot. We just know that to be true for some kids. So it's not any different for this this vaccine. Getting a shot for some people is just kind of an anxiety-provoking experience. We've not had any serious allergic reactions, and nothing even more than mild at Pier 2.
You know, we're seeing the headlines just from across the country of different states and health leaders who are just pleading and urging officials to get them the vaccine, that they just need more. Are you at all worried with the timing and the way that this is getting rolled out, that this could take some time? Or are you confident that as more vaccines come online, like Johnson & Johnson, that we should see a significant ramp up in the amount of doses that are being able to be distributed?
Yeah, we keep being promised that there'll be a ramp up, and it looked for a while in January like we were heading in that direction. Things have now become very static, and every week we're getting about the same amount, and the same amount is about half or less of what we truly would be able to use. So we would love to see the vaccine supply increase. Obviously, as we get new types of vaccine like Johnson & Johnson that will add an additional supply, that will be helpful. It's going to take a long time to get through all the folks who want vaccine at the rate we're going now. We would love to be able to push it much harder.
You know, when we do see the COVID-19 positivity rate, the wonderful thing is over the last few days, at least, the numbers do seem to be going down dramatically. But one of the things that is concerning is that we do see deaths reported consistently, when they come out with the positivity numbers. What are you seeing in terms of those fatalities? We know that treatments for the disease itself have improved as we've learned more about the virus, but who is still most vulnerable for very serious consequences from the illness?
Yeah, I think, first of all, we need to say that the rate of death from COVID in Hawaii is the best in the country and has been for a while. So we have a very low rate of disease and a low rate of death, and that's great. The people at most risk for dying from COVID are those who would not be surprising to us. It's the very elderly. You remember back to the outbreak in Hilo in the veterans home. Those folks are elderly, they require care, and they are at most risk. The other folks that are at risk may not be as elderly, but have significant other disease. So people who are being treated for cancer, for example, may have more risk. So it's folks who are already ill with something else or who are very elderly and frail, and the COVID virus disease is just kind of the last straw for them.
We're seeing also on the mainland just the number of cars that are lining up in these stadiums, the long waits that people are going through in order to get that. We haven't seen that here, as things seem to be managed pretty efficiently. Obviously, our numbers are not what maybe they are in some other mainland and national cities. Are you at all worried that as things pick up, that we could just see this mass influx of people who fall into a category of their time? How are you going to manage that as as the vaccine becomes more available to, say, the different groups down the line?
Right. One of the things I think we're really grateful for is that people in Hawaii have actually paid attention when we say, it's appointment only, and we're serious about that. And Queens and others are all doing the same thing. They're respecting that appointment process. So we knew that if we, for example, at the end of the day had, vaccine that we would just kind of let anybody lined up get, that we would have long lines. People would bring their lawn chairs and their coolers, and they would sit and wait and hope. And so we've been very, very clear and very consistent in not allowing drop-ins, not providing sort of these random doses of vaccine just on the happenstance that somebody might be there. So I think that that's worked out really well. And people in Hawaii are just really respectful of the way we try to do things, and it's working out really well for us.
Let's talk about kids for a moment. We know that you are a pediatrician. First, on the COVID-19 virus itself in children, we've heard that most children do recover, but can you tell us about any serious cases here in the islands, what you see in kids? And also, this sort of the second half is the vaccine. When do you expect children to be able to get it at some point in the future?
Right. So as far as COVID disease among children, we've had at Kapiolani, I think it's maybe 10 kids total, or maybe not even that many, across the almost a year now that we've been dealing with this infection. So the number of serious infections in children is really low. Mostly if they have something that needs hospital stay, it's because their immune system has overreacted, and there's an odd immune system disease that kids sometimes get after a COVID infection. So it really has not been a big issue. The part of that may be because we've got children not in schools. They're all doing the remote learning still, or maybe it's just changing now. And that means that kids have not been passing it to each other and have remained relatively safe. As far as the vaccination goes, it looks like it's going to be maybe another 6 months or so, perhaps, before we are able to vaccinate kids. The studies that are being done by Pfizer, Moderna, Johnson & Johnson, AstraZeneca currently are looking at 12 and up. Only Pfizer has an emergency use approval for 16 to 18. Everybody else is 18 or older. And younger children than 12, I think it's going to be quite some time.
What are you seeing in terms of the impact that it's having on the hospitals within Hawaii Pacific Health? We know that there was a surge earlier, excuse me, not earlier, but last year around the summertime when we saw those 300 cases a day, and things have certainly gone down from there. What are you seeing in terms of just the overall hospital visits? How has it impacted just the overall service that you folks continue to provide, knowing that you have to protect other patients who have other ailments that are coming into the hospital as well? And how are you managing that at its current rate?
Yeah, I think that's a good question. It's been 11 months since this first became our world. And we have learned a lot, and we learned it very quickly, actually, on how to protect employees, how to protect other patients, how not to spread this disease among folks in the hospital. So the hospitals are safe. For a long time, apart from the COVID increase in patients, we've had people staying away from the hospital. They're very concerned about the safety of their care there. They've deferred elective procedures and so forth. And so that means that for the most part, our hospitals have been quite low in volume, lower than normal. Now, in the last month or so, we always have a surge over the holidays and into January. And for the last month or so, our adult hospitals, Palimomi and Straub, have had more normal levels of patients and almost no COVID patients. So I think today we have 3 COVID patients in one hospital and 4 in the other, Palimomi and Straub. I don't remember which is which. So the numbers of patients with COVID are really low. And we're beginning to see more of the regular kind of patients that we would normally see. And we just want to make sure that everybody knows that they're very safe. If they need hospital care, we know how to take care of them without having them worry about COVID.
You know, early on in the pandemic, we did have you on here and we were talking about the first sort of forays into telemedicine. Of course, telemedicine has been around for some time, but a lot of us have just experienced and start to engage with it because of COVID. What are you seeing in terms of that? Are more people engaging in that way? And what do you tell people? Because despite those assurances that you just laid out, there are still people who are reluctant to go in person, but definitely need to reestablish those relationships.
Right. And so I think, thank you for bringing that up, because I think telemedicine has been expanded way beyond what we would have thought our capacity would have been a year ago. It's amazing the kinds of care that can be provided in a virtual visit. As a physician, we always thought you had to be able to listen to the heart and listen to the lungs and actually, touch the belly and so forth. But a lot of care can be provided without that. We still do need to do some in-person visits, and those are being done. But I think if any patient has any question about that, they should reach out for a virtual visit first. And then if there is a need to actually see them in person, that will be discussed and described.
Heading back to the vaccine, and as things become more vaccines become available and we get to the larger population, not maybe the critically ill, maybe not the ones, the 65 or older, and just the general population, how will people know when it's their turn? I think a lot of people right now are in that category of, I know it's not my time, so I'm just going to wait. I'm not really paying attention to it. But when that time comes around and it is their time, how will they know when it is their time? Will they get an email from a doctor? Should they be checking in? How will they kind of get that alert?
Yeah, it's a really good question. There's actually a communication work group of the Department of Health trying to think about all of that, because even among the groups that are being prioritized next, how do we make sure that they know that they're in that group or not in that group and so forth? And so it's a difficult problem. I think will take all of us. It'll take the media, of course, you guys, the Department of Health, but also each of us as healthcare providers, sending messages to our patients, putting new updated information on our websites and all of that sort of thing. To try to get that word out. There are some people that are hyper connected and absolutely, pay attention to everything, and others who just, as you say, are kind of not paying attention so much. We did have an experience a couple of weeks ago where it's interesting how quickly something can go viral on social media. And so we had, for a very brief period of time, some open scheduling slots available, and that went out like crazy. And within half an hour, all of the appointments were gone. So there is a lot of interest, and I think people are quite connected through social media too.
Let's talk a little bit about masking. There's some new information even in today's paper talking about how double masking could be something that would protect us against the variants. What's the advice you're giving in terms of how many masks to wear and the kind of mask we should wear?
Yeah, it's an interesting conversation because we were hoping that as we got more and more people vaccinated, we might actually be able to back off on masking and go to some sort of new normal where that wasn't as needed. The variants have changed that discussion. And so because the variants, all of them, are more effective in establishing a presence in a nose and then multiplying virus quickly and spreading more quickly, the need for masking is more important. First of all, the most important thing is don't let your mask drift down off your face, down below your nose. So if you're going to wear a mask, wear it properly. That's number one. The idea of a double mask is that if you use a surgical or procedure mask, the kind of mask that we can now find at all of the drugstores and grocery stores and Costco and Sam's Club, everybody's selling them now. That mask goes on the inside and then a cloth mask on the outside. And the combination of those two, if they fit well, actually will get you pretty close to the filtering capability of an N95. So that combination of two masks is actually really helpful to reduce that chance of spread. But at the same time, it's wear the mask properly, keep your social distancing, wash your hands, stay out of large groups. So it's not just the double mask, it's all of the other pieces as well.
There was an interesting report a few days ago about the overall spread of just the influenza and flu amongst the community and the dramatic drop that we're seeing throughout the country, attributing a lot of it to the dynamics that people are taking now with social interaction, with mask wearing. Is this something that you could see being effective for a longer period of time, knowing that this is sort of changing the way in which people interact with one another and moving forward, how this COVID-19 will impact other viruses like the flu?
Right. All respiratory viruses, actually, we're seeing a great reduction in respiratory illness in children as well, not only influenza. So yeah, it's very clear they all pass kind of similarly, and the same tactics that we're using for reducing the spread of COVID work for all of those respiratory viruses. So maybe we'll all learn that during flu season, a mask is not a bad idea, keeping your distance is a good idea, washing your hands is a good idea, that kind of thing.
Going back to your work as a pediatrician, I know a lot of parents are now trying to decide whether to send their kids back in person or not. How are you advising people to make that decision? Well, I mean, it's a tough decision. We understand that people want to stay safe. I think that currently the science is looking like children in schools, particularly younger children in schools, are really not very high risk for COVID spread. And if we can get the teachers vaccinated, that would improve it even more, because we don't want the teachers to be at risk either. The loss of that in-person school experience is real. That's a problem, and we're going to suffer the consequences of that loss of instructional function, I think. And so as a pediatrician, I encourage people to try to get their kids back in school if there's a safe way to do that.
Going back to the vaccine, as we begin to see more options available and more of these get approved, will those who are getting the vaccine have a choice to decide which ones they're getting? Obviously, the Johnson & Johnson only requires one shot as opposed to the ones that are available now. How much flexibility and how much say will people have in terms of what vaccine they would like, if there is a preference? That's
a great question. For a mass vaccination site like Pier 2 that we're running, it will be really difficult to offer a choice. We've already had a few people, we had 2 days where we were using Moderna vaccine instead of Pfizer because we had supply, and that's the way we did it. And on those 2 days, we had a handful, not a lot, but a handful of people who said, hey, I thought I was coming for Pfizer, I don't want Moderna, what can I do differently? Can't you give me Pfizer? And it becomes a real difficult problem. So we actually have made the decision to try to be using a single vaccine on a single day and not trying to switch. There's safety issues in terms of making sure that you draw them up correctly and give the right one to the right person and all the rest of that. So it's going to be very difficult for a large site to manage multiple different vaccines. Whether you'll have a choice if they are all stocked at your local pharmacy, perhaps.
Okay, our time is wrapping up, but before we go, we just want to give you an opportunity. What's your message to the public as we wait? Everyone, is always checking that website, especially those of us who have parents who might be older, checking, is it their turn? Is it their turn? What's your advice to people right now as we wait?
Yeah, it's so hard to wait. I understand that. We are committed to making appointments available as soon as we can be assured that we have vaccine to deliver a dose to those that have the appointment. We've committed to that. Right now, we're struggling to make sure we have enough vaccine for all of the second dose appointments we have. We're going to be very close, and we're hoping to get just a little bit more so we can complete those without having to postpone any appointments. But we are postponing some first appointments, and we will not be making any new first appointments for anybody that's interested right now. And it'll probably be a couple more weeks at least before we have any available.
Okay, before we let you go, I just wanted to ask on a personal note, you mentioned you've been doing this for 11 months now, and obviously those in this healthcare profession, there's been a lot that's being asked of you. When you think back to the beginning and just learning how this virus has impacted the community to where we are now with the vaccine rollout and the care that you folks have to provide. How are you just holding up? I mean, it's got to be very stressful with all the demands. You're doing things like this, speaking to us at the media, and this could be going on for some time. I just wanted to get your thoughts on not only you, but your colleagues. How are you guys holding up during a season where it's difficult to see an end in sight, where there's just so much work to be done?
Right. And thank you for asking. I think, first of all, fortunately, Hawaii has been much less affected than other places. When, vaccine rollout started in December and January, and we were hearing about hospitals on the mainland being asked to step up to do vaccinations, as well as being completely overwhelmed by caring for COVID patients, we just thought, oh my gosh, aren't we lucky we're here? We have a great team of people at Hawaii Pacific Health. So although I'm the one that gets to come on to these sorts of calls and do this sort of thing, there are an awful lot of people who are all shouldering the burden as well. So it's been a team effort from the beginning. It continues to be. And the other thing is, it's really interesting. We've got a lot of us at HPH working at Pier 2 and a whole bunch of people that are coming down to volunteer. And that is a great environment to be in. People are so grateful for the setup and for being able to receive their vaccine, that over and over and over again, we get a lot of gratitude expressed, and it really helps to reinforce the value of what we're doing. So, we're holding up just fine. We're waiting for the next curveball to come. Something will come, I'm sure. But at this point, everything is going well. We're very grateful for the people of Hawaii and how well they've responded to this from the beginning. And that's made all the difference.
Okay, well, Dr. Melinda Ashton, thank you so much for joining us today from Hawaii Pacific Health. We appreciate your time.
Yeah, thanks so much.
Wow, a lot of information there. Very interesting to hear her talk, both as an executive at the hospital and also as a pediatrician. One thing that did stick out to me is she said that they're not making any new appointments right now at Pier 2 for any first vaccines because they really want to make sure that they get through the second doses. And so those are the delays that we're seeing as we really eagerly await the doses. And there are calls, of course, for 65-year-olds to now 65 and up to be able to receive the vaccine. But it doesn't sound like that's likely just because they simply don't have the doses.
Yeah, and it's got to be frustrating for them knowing that it's something that they can do. It's something they prepared for, but they just don't have it in their hand. We heard earlier this month how optimistic the lieutenant governor was about the ramp up in numbers and how he sort of said that, in a few weeks, we're going to see this large increase. And we're seeing now that delay and the fact that Johnson & Johnson is still waiting for that approval, that has just sort of delayed this overall process in getting the availability of the vaccine out there. But as she mentioned, and as I've heard from people, and I'm not sure if you heard too, a lot of people having very positive experiences when they're down there, saying things move very efficiently and that it was a seamless process. And we hope to see that continue as more and more vaccines become available.
Absolutely. I mean, it's very reassuring to know that the infrastructure is in place so that once we do get the doses, she said that on their level, they could do more than double the doses that they're giving out right now. So that is reassuring. She also talked about masking and suggesting that if you do want a double mask, it's a good idea to get one of those paper filter masks that you see sold basically everywhere right now, and then a cloth mask over that. And that will protect against the new variants more effectively than just wearing a single layer mask. The other thing that she said was that they do see that there is some protection, at least initially, from the Pfizer and Moderna vaccines against these variants. So that is reassuring as well. But you can't necessarily fully change behavior. We still have to mask and socially distance even once you get the shot.
Yeah, and like anything else during this time, there is that level of uncertainty as they're learning everything as we move along through this. And the signs point that everything is looking good with this vaccine, and we continue to hope that as more in the community get that it will be reflected in the number of cases we're seeing. Again, we're already seeing those numbers go down. Hopefully, they will continue to stay down. She's also said how they're seeing more return to normalcy in terms of the hospital and what they're seeing with people coming in with just the types of ailments that people come into the hospital and receive treatment for. That declined earlier on in the pandemic, of course, as people tried to stay away from the hospital. So reassuring and encouraging to hear that people are feeling more comfortable getting adequate care as needed.
Right. And as a pediatrician, she did say that, there are a lot of downsides to keeping kids out of school. There's a lot of people now pushing to allow youth sports to resume even ahead of full school. And we're going to be talking about that on Friday.
We're going to be focusing in on that topic, as you said, and that's going to be something that I know a lot of people are passionate about. A lot of parents out there want their children to be able to get back to those physical activities. So we're going to be speaking to two individuals who are leading the charge in this effort here on the island of Oahu. We're going to be talking to Council Member Andrew Tupola, as well as Chad Owens, a former professional football player, who have taken this initiative and really trying to allow safe sports to resume here in the city and county of Honolulu. So we've been talking to them about their efforts and what they're hearing from the mayor, if something like that will be allowed sooner rather than later.
Yeah, and then next week we have Lieutenant Governor Josh Green joining us on Monday. Senator Brian Schatz will join us on Wednesday. Very interesting to hear from him in terms of what federal support will be available. Also interested to get his thoughts on the impeachment hearings. Those are actually happening right now, and so we'll hopefully have some time to reflect on those. And then on Friday, an always popular guest, we're going to have Ann Pereira Estaquio. We know so many of you are struggling with these unemployment claims and the delays in the PEUC distribution, so be sure to join us next Friday to talk with her and to hopefully get some answers about when those payouts are coming.
Now, looking forward to another great week of conversation. We thank all of you. We thank Dr. Ashton, as well as all of our medical professionals who continue to work hard to keep our community safe and healthy. So thank you to them, and thank you for all tuning in. We'll see you right back here on Friday at 10:30. Aloha.
Aloha.